Respected Dr. Trehan, Madam Shailaja Chandra, dignitaries on the dais, and ladies and gentlemen, good evening. I'm a radiation oncologist, and as Dr. Trehan said, that we try to find powerful X-rays to knock out the cancers in the body. And we try to minimize the collateral damage by either advancing the technologies or adding on some radiation protectors, or to increase the cell kill, we add on some radiation sensitizers in the form of drugs or medications to the patients. And especially for head and neck cancers, radiation is one of the mainstays of treatment. We have tobacco largely accounting for 1/3 of cancers amongst males in our country. It's a huge burden that we see. And if we go in for surgery, it is quite defiguring for the patients. So addition of radiation post-surgery at times is required for stage 3 and 4 patients to get well. But when we give radiation in the face and neck area, it leads to a huge reaction in the oral cavity and the mouth and the neck, which delimits the patients from taking good food and thereby adds on the burden of either having a tube placed through the nose, through the stomach, or having IV fluids, which adds on to the cost of the treatment, and it is quite disfiguring. And it's a stigma. You have a tube through your nose and you can't go out. You can't eat, you can't taste food. 10% of our body weight of our patients would fall during radiation. So in this background, we've been using additional medicines or additional aids to support the patients through 7 weeks of treatment. And in November 2011, I had a patient who was referred to me by Dr. Geeta Krishnan. And this lady is in her early 80s. She has an ejection fraction of 15%. And the cardiologist has referred her to Dr. Geeta, looking at her tongue, where she has a stage 3 cancer, thinking that she cannot undergo surgery. She has a high risk of anesthesia, and the surgeons will not operate upon her. And Dr. Geeta calls us up, "Ma'am, can you do something for this patient?" Well, I've given you the background, what radiation is going to do this lady, who already has other comorbid conditions. She is at a high risk of losing her nutrition, her weight, and I'm going to make her very sick. If she is my grandmother, I won't do it. So that's what I told Dr. Geeta. I said, I need you to help me through this patient, because if I don't treat her, she's going to be in pain, her tumor is going to fungate, and she'll have a miserable life for whatever time she has, whether it is 6 months, 1 year, 2 years, whatever. And if she's my grandmother, I know what radiation can do to her. I can help her, but I cannot help her with the supportive care. So he talked to me and we spoke to the family, and he came up with some combination of honey and trifla. And we said that it shouldn't cause a reduction in the tumor effect of radiation, and it should not even increase the effect of radiation on the patient. So it was a stringent criteria with which we started working with him. And lo and behold, she completed her 6 weeks of therapy without ever getting admitted, without ever needing IV antibiotics, IV fluids, and she continued to take solids. So that's where was the opening line for us. And in the last 1.5 years, we've had this kind of a combination and maybe a few other medications which Dr. Geeta prescribed to my patients for 10 patients, 3 of them females and 7 of them males, all in the oral cavity and head and neck cancers. And we've had these kind of wonderful results. We still have to go a long way to say what happened to the tumor. The tumors have subsided for the time being, but in the long range, we'll get to know what's going to happen. So as Dr. Trehan said, we need to find out what is the active element of these herbal medicines or the churans that he's giving us or honey, whatever is happening here. We need to still go a long way to find out, scientifically prove to the world that what Ayurvedic medicine is doing is working, and it'll work for everyone, not only for our 10 patients, but for everyone else. And few of our patients, we've worked with him for giving relief for arthritis, about 7 of them, which was again a comorbidity in addition to the cancer treatment that they were being given, and they did not want to take any more medicines. So with these words, I think I would like to thank everyone.
There'll be a lot of questions.
Right. You're most welcome to have the questions, right? Thank you.